for the new grads especially, find a mentor. A lot of new grads are so worried about their student loans that they take the highest paying job. They want to travel and get the highest, hourly rate that they can get. But boy, that first year or two out of school, if you don't have somebody that you can bounce ideas off, it's really challenging. So mentorship has really been so vital to where I'm at today. I wouldn't be here without all of my mentors, and new grads should really look into that.
We are thrilled to welcome a legend in the world of physical therapy to the show, Dr. Paul Mintken. Paul's impact is truly far-reaching. He's not only a professor right now at Hawaii Pacific University and the University of Colorado, but he's also a hands-on clinician, highly awarded teacher, and prolific researcher with over 60 peer-reviewed articles. Beyond his professional accolades, Paul's story is one of resilience and authenticity. In his recovery from alcoholism, he credits mindfulness with saving both his career and his life. Today, he openly shares his journey to sobriety and his passion for helping others navigate their own paths. Paul also brings a deep interest in the power of patient expectations and their impact on PT outcomes. So, get ready to dive into an inspiring conversation with someone who's redefining what it means to care for both body and mind. Paul Mintken on Hands On, Hands Off. Paul, welcome back to the show.
Thank you.
I didn't look it up, but I think I might have been still a student when I interviewed you last.
I think it was, yeah.
Yeah.
Yeah, when I was keynote in 2017 or 18 or something.
I think I went to that one, or I was in person for one of those, and I think I was brand spanking new. So I was sort of walking around this profession. And art imitates life. Yeah. Launch a podcast where I'm going to walk around this profession and pretend like I know what I'm talking about long enough to stand next to people who do know what they're talking about and just record it. So appreciate you coming back. So you're speaking here at AAOM 2024. Yep. You're talking about mindfulness. Mm-hmm. And how do you bring that into a manual therapy conference? How'd you slip that past the front gate?
Yeah, well, the students asked me to come speak on a topic. And it's something that I really credit with saving my career and maybe even my life. You know, because I was in that vicious workaholic, alcoholic kind of lifestyle, drinking all the time and not really tuning into the present moment. And, I had a few experiences that just woke me up, and I started to use it personally. And then I started to use it with my patients with chronic pain and just, tuning into your body and being in the present moment is so powerful, just not being dominated by your thoughts, because a lot of the chronic pain patients, they're just thoughts one after another. And if you can just slow it down a little bit, it helps their pain overall. So it helped me personally to just realize what's important in life. But it also helps my patients to put things in perspective a little bit rather than just, catastrophizing and ruminating all the time. So
how's it received when a patient comes to a physical therapist and you say, hey, we're going to do some stuff about thinking and mindfulness? How's that go?
Well, you said, how does it tie into manual therapy? When I'm doing manual therapy on them, a lot of times I'm talking to them about this kind of thing. And I say,
it's not just one or the other.
Yeah, and I've had experience with chronic back pain and neck pain and things like that. And so I just relate my own experiences and how, we have 60,000 thoughts a day and 80% of those thoughts are the same freaking thoughts you had yesterday. And how that can just become this vicious cycle that, especially when you're in pain, it becomes really hard to stop. So if you can just tune into the present moment and just acknowledge that the present moment is the only thing you ever have in this life and stop worrying about tomorrow and what happened yesterday and that type of thing, it just makes life so much easier. So I use it while I'm, working on patients or stretching them or doing those kind of things. And I just drop seeds here or there, and then I tell them about resources, and if they're interested, I send them to them. If they're, some patients are like, not for me, that kind of thing. But a lot of people think of mindfulness as meditation, and it's not that at all. I mean, meditation is a form of mindfulness, but it's just being in the present moment, living in the present moment, and that's all it really is. So that's how I kind of incorporate it.
Well, I asked how patients feel about this. How about other therapists when you present on something like this? What are some questions that you typically get, and how do you answer them?
Yeah. The most common one I get is that I can't stop thinking, and I'll sit down and try and do some breathing or that type of thing, and the thoughts just never stop. And the big thing about mindfulness, the definition I like the best is paying attention to the present moment on purpose, without judgment. So you're going to have thoughts. I mean, the mind secretes thoughts just like your salivary gland secretes saliva. It just happens. You'll see something and it'll trigger a thought in your head. And once you realize that that's just a chemical reaction in your brain, and you don't have to latch onto that and perseverate on that thought. So a lot of the people are like, how do I stop my thinking? And that's not the point. It's not stopping thinking. It's just being aware of your thinking. And if you see a thought, okay, you acknowledge it, but you don't latch onto it. So I tell them to bring grace into it and not judge themselves, that they, it's not about clearing your mind of thought. It's just about tuning in, and then you can dig a little deeper if you do have a thought or an emotion or something like that. Rather than stuffing it like we all do, you can explore it a little bit, play around with it and see where's this coming from.
Give me that definition again.
Paying attention to the present moment on purpose without judgment.
Yeah, and that sounds important.
Yeah, very
that
important.
last part especially.
Yeah, the judgment part, because we judge ourselves. Nobody's harsher on us than ourselves.
You could not be more true. This is somebody for me also. I mean, you're saying this, and I'm like, okay, gosh, I got to listen to this later. Similar, right? 1,000 thoughts a minute, and let's worry about the past, present, and future, and what's going to happen. And man, that could ruin a lot of things.
Yeah. It does. And, the present moment is the only time you're alive.
That's it.
It's the only time you can love or see or hear or taste or touch or smell or anything like that is now. So why not live here?
Yeah, that's well said. Awesome. You're also presenting on the patient expectations of their influence on PT outcomes. Patient expectation, what they think might happen in the future, on their outcome, actual future. Help us understand your research on this area. What's the most surprising thing you've learned about when you're looking into expectation into outcome, patient expectation to patient outcome?
Yeah, so, patients will have expectations about everything. We judge everything that we see. And maybe they had a cousin, sister's brother who had an experience with this, or they look up Dr. Google and they see this, so they have an expectation about it. And so, we just, in our research, we always captured what are your expectations? We do a lot of manual therapy research, manipulation. And do you think manipulation will help your condition? Do you think exercise will help? Do you think stretching will help? Do you think aerobic exercise would help? And we just explore what they think will give them the most relief. And we found that the patients who expect that manipulation or manual therapy will give them the most benefit, they have the best outcomes in our manual therapy studies. So it kind of, feeds right into that situation. And there's just so much research out there now that patients' expectations will drive the outcome of treatment. If they expect a good outcome, they're much more likely to have a good outcome than if they don't expect a good outcome. So we're just talking about, the research that supports that, but also exploring the expectations. When you get to the end of your exam and you say to patients, okay, the research would suggest that this would help you, that maybe a manual therapy technique, this exercise might help you. We can do some education on why you're having this pain, and what are your thoughts on that, and what do you think would help you? What are you interested in learning more about, or which interventions sound interesting to you? And we published, Joel Bialowski and Josh Cleland and Mark Bishop and myself published this article a couple years ago called The Healthcare Buffet. So when you get done with your exam, you're like, well, this is what the evidence says would help you.
Right. What do you want to choose?
Shared decision making.
Yeah.
What do you think would help you? And present it to the patient in that. Maybe they have a strong belief that manual therapy would help them, or maybe it would hurt them.
Yeah.
And so, finding out what the patient's expectations are, and then maybe if their expectations are not valid, they're based on something they read on the internet or their cousin, sister's, brother's experience, that kind of thing, you can start to educate them or inform them. But if you don't at least explore that, you're handicapping yourself a
Well, I
little bit.
wonder, in your research, did this ever come up? How often are therapists actually asking that question? Like, we ask, what are your goals? What would you like to happen? But I don't know if myself included, if I ever actually asked, like, what's your expectation? What do you think would actually help? Or what do you think manual therapy, whatever we choose together to treat this, how that would go? I think I'm guilty of not asking for that.
Yeah, it's not something that we're trained to do in our entry-level training and that kind of thing. So, that's what we're kind of advocating for, to kind of explore those expectations, because maybe they do have a strong expectation for one treatment. The classic example is ultrasound, right? The patient comes in and says, last time I had back pain, I had ultrasound, and that really helped me a lot.
Right.
And the evidence-based people would say, not much evidence for ultrasound. We're not going to do that. just
that
neglecting that
person's
patient's experience.
Yeah.
And that's counterproductive overall. And if the patient strongly feels that ultrasound will help them, I'm going to do the ultrasound, but I'm also going to be educating the patient while I'm, rubbing the gel around their back and that kind of thing. So yeah, I think it's something that we should, at least acknowledge and ask our patients. It doesn't take much time to do. So.
Yeah. Talk about where you are now. You're doing a little bit of a unique role. We were talking before we hit record of what you get to do 5 times a year. You really got to suffer.
Yeah.
You got a real tough assignment a couple times.
Yeah. So, just a short history. I started at the University of Colorado as a staff PT, so I was on the state pension plan. And after 28 years, I taught for 20 years at the CU School of Medicine. I had a pretty sizable pension, a monthly take-home for doing nothing. And this job offer came up at Hawaii Pacific University. There's never been a PT program on the island in Hawaii, in the state of Hawaii. And so it's a hybrid program, 2 years in and out. And I have to go to Hawaii 5 times a year to teach the lab. So I'm online with students for 7 weeks, and then we fly out and do all the hands-on, like the musculoskeletal courses. There's 4 of them. So I have students in lab with me 8 to 5 Monday through Friday for a full month.
Wow.
During the training for the DPT, and it's an incredible amount of contact hours, and we get to really explore clinical reasoning and decision making and all these lifestyle things, mindfulness and expectations, and way more than I had time for before in a residential program. So. That's
great. That's fantastic.
Yeah.
Favorite thing to do in Hawaii? If someone's going to go, what's the thing they have to do while they're in Hawaii that maybe they wouldn't expect?
Oh man, I've done a couple of Kodiak, or what do they call those? Zodiac boat rides, and just going, like Kauai is my favorite island, so I go over there. I love hiking in Hawaii, although that can be really hazardous because if it rains, the trails are like mud and they turn into like ice rinks. But hiking is just fantastic. Just soaking up the different climate zones and things like that in Hawaii, it's just an amazing experience. And then the culture too. Yeah, you have to do like a luau and experience, because the Hawaiian people are so grounded in what it means to live. How to be present. Yeah. And I love that.
Well said. I won't make you think too much in the future because we want to be present in right now. But what might be in the future for you? I feel like you've done a variety of different things in terms of education, where you've done it, what you've done, and how you've done it. But what might be in the future for you and the different things that you're looking into and researching?
Yeah. We kind of talked about my past and burnout and things like that. So I'm really interested in that in academic faculty. Nobody's really looked at that in the faculty burnout. It's really high. And so we're starting to explore that and just coming up with some strategies that we might be able to mitigate that overall. So we're starting with a study right now. Megan Donaldson and Josh Cleland and I are looking at burnout in academic faculty in the allied health professions, so speech, OT, PT, and that kind of thing. And we're just going to explore that and see, because I think it's an under-recognized problem of burnout, because, academia is like a treadmill. Once you get on, you can't stop running.
Yeah, so. Yeah. Last thing we've been doing is these parting shots. So an idea, comment, quote, sentiment. What would you want to leave with the audience as we wrap up?
For the new grads especially, find a mentor. A lot of new grads are so worried about their student loans that they take the highest paying job. They want to travel and get the highest, hourly rate that they can get. But boy, that first year or 2 out of school, if you don't have somebody that you can bounce ideas off, it's really challenging. So mentorship has really been so vital to where I'm at today. I wouldn't be here without all of my mentors, and I think new grads should really look into that. Money stuff will take care of itself down the line. Start your career off on the right foot.
Yeah, well said. Paul Mintken, good to talk to you again. Thanks for being showing me how to be present in the moment.
Oh, you're welcome.